Hi, I'd like to welcome everybody to this exciting roundtable that we're going to be having on pandemic premiums and health insurance repercussions in a post-COVID world. We have a fantastic lineup of panelists who you can see on our screens here. And if you would like to know more about them, please visit their speaker bios in the forum portal. So I want to really focus today's discussion with our group, which includes folks from the insurance industry, who are all employers, people who work in medical benefits, thinking through what health insurance looks like after the pandemic and during the pandemic, but also talking a little bit about risk, what it means to be an employer and how they're thinking about benefits. I'm going to start this conversation by opening it up to a roundtable and asking, especially those of you who are in the insurance space, how has the pandemic, the costs associated with it, government intervention, continued risk that we see, how has it made you rethink the concept of risk in the health insurance business, be it financial risk of health, and what it means to take care of people, but also be responsible to your shareholders and try to maintain the appropriate regulatory standards and bottom line that you have to as an insurer. Jason, maybe we can kick it over to you. You're part of Cigna International Markets. I would really like to get your thoughts, and then some of our other folks who work directly in the insurance space can weigh in. And we do intend this to be a free-flowing meeting, so I won't be steering the entire discussion. You'll see our other panelists jumping in as they have thoughts.
Okay, thanks, Drew. Obviously, risk is very much what we're all about as an insurer, and often when we think about risks, we often sort of focus a lot on the sort of catastrophe, sort of extreme events. I think none of us could ever have imagined 2 years ago that we'd go through a period of like this where a pandemic sort of lasted for so long, and as we thought we were coming out of it, a couple of months later in many countries we saw second waves, third waves, etc. So I think our whole sort of approach to sort of risk and risk management has in many ways been sort of turned on its head over the last 18 months. On the positive side, though, if I sort of turn it around, and there are positive things I think that have come out of this pandemic, and a lot of people tend to focus on the negatives, but people's agility and adaptability to change the way they work, the way they communicate, people's focus on their own sort of health and well-being, the health and well-being of their friends, their colleagues, etc., has really been sort of accelerated in this period. And in many ways I think that is going to have sort of much sort of longer term sort of benefits, which ultimately may mean that people can actually manage their health and well-being much better. At the same time, we've also seen mental health issues spike. Cigna has been doing what we call our health sort of 360 surveys for 5 years now, and we'd already seen that sort of growing trend in terms of mental health challenges, mental health awareness. And again, that has really spiked significantly as well, and that's going to be something that we're going to have to continue to sort of monitor and focus on the years ahead. I'll stop there and let others sort of pile in.
Yeah, Vivek, do you want to chime in? I mean, you deal with a population that's particularly susceptible to some of the risks of COVID. I'm wondering what your experience has been, from a risk standpoint, and how it's had you all recalibrate your thinking around that space.
Yeah, no, it's definitely, I think, in some positive ways, brought a lot of the right attention to the population we serve. So Clover today has about a little over 50% of our membership is minority descent and of low income. So typical kind of larger payers are less than a third. And if you rewind before March of last year, there was definitely a lot of discussions around social determinants of health and health inequity, but it was not tangible to the vast majority of people in healthcare unless you literally operated your system or provider base in a lower income community. And I think so when we talked about health equity before, or our mission of improving every life, there wasn't really an understanding as to the inequity that exists in the United States today. So now you fast forward to today, we've seen firsthand lower vaccination rates in lower income communities. we've seen firsthand where if in our population being elderly, that means there's a higher percentage of them that have kids or grandkids that are probably part of families that, did not have the luxury of working from home, that probably had to go to work because they were in an essential job. And then when you think about what that does from the perspective of infection rate and so forth, everything becomes, I think, pretty tangible. And so, I think our hope out of this is there's a true understanding on a first principles basis, whether it's on the regulatory side, folks on the business side, that there's a lot more of a nuance required in investment, technology, et cetera, to really drive that value for that population. Even if we take, the ecosystem of lower income communities, that means that an average primary care physician has a larger percentage of Medicaid patients. So we wonder, how does that affect the elderly population? Or if you have a higher percentage of Medicaid patients, that literally means that physician can only spend maybe 5 to 10 minutes with his or her Medicare population because they still need to maintain their own income levels versus kind of their peer group in a higher income county. And so there's a lot of these details that were really glossed over a year plus ago or sort of ignored or not really treated as legitimate. I think there's a lot more good attention now brought to that we think, everyone's going to benefit from.
Kathy, I want to ask you, you're a large employer, as well as working in communications field, I'm sure consulting with a lot of these companies. When you're thinking about how you all are going to approach insurance, and coverage and the benefits that you talk to about your employees, has the pandemic meaningfully changed your thinking in terms of what people need? And, as a steward of their benefits and a steward of these folks, how has it changed your thinking, not just as someone who works in and consults with these industries, but just as someone who hires people and has to attract people to come and work for you, who are thinking about this?
Yeah, so I think as Jason and Vivek have just said, there is a huge amount of adaptability and flexibility that's emanated from this period of time. The question is, are we going to be able to make this transformative, or is it just going to really result in some incremental changes? And by that, we saw, of course, telemedicine. We saw digitization of clinical trials, which enabled or will and continue to enable better inclusion in terms of clinical trials with a more distributed model. But in order for these things to actually be sustained going forward, we're going to need policy changes and regulatory changes. Are these temporary? Is reimbursement for telehealth going to remain at the same levels as people going into a physician's office? Are we going to be able to conduct clinical trials in a way that's going to, fulfill regulatory requirements, for distributed trials and for more digitization of the entire clinical trial process? So I think that that's one chapter of change. We've seen like new levels of collaboration that we have in private-public, working together to actually adopt and to really move quickly. Who would have thought we would have had mRNA vaccines, within months rather than the really long period of time that vaccine discovery takes. Same thing for therapeutics. So there's been a real willingness for people to think out of the box and for people to really change the way they're doing things. And if we can really continue to work together to sustain that kind of attitude, which is really hard to do. It's okay to do it in a crisis, but it's very, very hard to change, policies and standards and guidelines in a way that's going to enable us to keep some of the good things that came out of the pandemic. Both Jason and Vivek are talking about sort of a new attitude that people have toward their own health and wellness. We're not really compensating prevention. But if we look at pricing, we need to look at pricing in a totally different way. What is the cost to a healthcare system, not what is the short-term cost of a particular treatment? And that's also extremely difficult to do. So I think we need to adopt a point of view and a collaboration that we need to think out of the box right now. And I think that is one of the biggest challenges that we're going to have as we come out of the pandemic.
You mentioned something that I really want to get some of our folks who work in the benefits and the doctor booking space in about telehealth. How much do people? I just want to throw this open to the group. There's been a huge boom in telehealth. How are you all thinking about that as a service and from a reimbursement standpoint going forward? And for those of you who do work in the kind of benefit side of things or the patient interaction side of things, how are you thinking about presenting that as an option? And for those of you who have provider experience, I'd like you to weigh in, or medical systems experience. Please jump in here as well. I mean, what does this look like when we are all going back to the office, be it 2 or 3 days a week or something like that?
Yeah, I mean, I was going to, sorry, I had raised my hand electronically. I don't know if you guys saw that, but I was just follow on something that Vivek said that I think is really important. And I think events or crises, if you will, like the pandemic, bring things into sharp relief. And so I think social determinants of health, to Vivek's point, and environmental determinants of health are brought into really sharp relief when something like this happens, and access to care is obviously one of those social or environmental determinants. And so from our perspective, telehealth is just another access channel or modality. It's always existed, or at least for recent memory, it's existed for people who are in remote settings or are incapable of actually getting to a physical facility. And this has just simply created a tipping point where this becomes much more of a prevailing norm. But I think to answer your initial question, which I think is important, I think companies, organizations, countries that are going to succeed in delivering healthcare effectively to their populations are going to need to be able to synthesize all of these social and environmental factors, I think to Kathy's point, and help people understand that they're on a path to a problem before they get to that problem, and to help guide them. And again, telehealth is a great channel for doing that. And I think systems like Vivek's team is building, Heather's team is building, I know them personally, which is why I'm highlighting them. Systems like we're building are designed to do that, to synthesize lots of what maybe historically has been disparate data that's not really been used by healthcare providers or payers, and to use it meaningfully to help people understand, like, hey, if you continue doing what you're doing, you're going to have a problem. And here's a really easy way to get sort of integrated into the system to get that problem resolved or prevent it from happening in the first place.
I see a couple of hands raised. I want to, Dr. Sheikh, if I can get you to respond to some of this. You all are running a healthcare system in a place that maybe has fewer of the legacy burdens that we sometimes see in the United States. I mean, if you could weigh in here with your experience with some of the telemedicine question, or how maybe the pandemic has altered the way that you all are delivering care, and if you think that there's applicabilities to that to some, more markets like the U.S. or Europe, where you have kind of healthcare systems that have, frankly, a lot of legacy assets that have been around for a very, very long time, and can, sometimes be wonderful things, but sometimes be impediments to change.
I will be glad to do it, Drew. Yes. So for everyone, just to give you an idea, I live in Qatar, and it's a unique situation in the sense that the largest funder, employer, and provider of healthcare is the government, and they have mitigated the epidemic quite well. What that has done is it has put pressure on the private sector insurers for them to really innovate, to basically survive and thrive. And I'm taking that as the point of departure, and then I'll go to the telehealth. And I think telehealth is one of the areas where there needs to be innovations, not only because we had to do it because of the need for accessibility during the pandemic, but also because we need to change the model in terms of getting the consumers more involved in their own healthcare. We have all kinds of apps out there in terms of health assessment, but we need to focus on changing the model just a little bit, and also include both the access to care, which Vivek and Jason were talking about earlier, but perhaps more importantly, I'm a psychiatrist, to bring in the mental health, get around the stigma. And for mental health, the easiest way to get appointments, to see the providers, is really telehealth. So along those lines, I'm not aware of what kind of lobby do you have in terms of the insurance lobby, but I'd be very glad as a provider to join that lobby to push for changes in the policies for coverage for patients. And I can tell you there's an epidemic within the epidemic in terms of mental health. The numbers are off the charts, and they're actually scary. It's lagging behind maybe a few months, but in about 6 months' time, you're gonna, well, if you travel, I just had a chance to travel to the US. after 18 months. And all I can tell you is everyone was on edge, and people were snapping at each other, including the stewardesses. It was very unusual. And I am concerned that unless we prepare for this, we are going to have the second epidemic of mental health problems this time.
Yeah, I'd support that. I mean, and again, I think we have to move away from the discussion of telemedicine, which is, very much sort of access, convenience sort of driven, to really broadening the conversation to virtual care. And I think there is a really great opportunity, particularly with the mental sort of wellness challenges that we're seeing the world over, to really accelerate the way that we look after our employees, our colleagues, by sort of bringing sort of digital technology to the forefront and using it as a way of virtual care. It's got a critical role in terms of driving greater affordability as well. But we definitely saw that spike in its use because of the fear factor. In many markets, I've certainly seen those levels have definitely come down. They're not at the levels they were pre-pandemic. They're still above there. But I think this is still going to be a journey that we're going to be on now for a number of years. But I think changing the focus in the discussion to virtual care as opposed to telemedicine, I think is really how we all need to be thinking.
Heather, I see your hand raised. I want to go to you next year.
Thanks. I guess I want to signal some more optimism that I see coming out of the pandemic, which is prior to the pandemic, American consumers were very complicit in the system as it was, meaning we expected things to be a certain way. I had to make a phone call. Waiting 2 weeks was sufficient. I must be sitting in front of you, whether it's my son's rash on his chest or it's my mom with her exacerbated COPD, right? In many ways, the expectation of what was possible was very low because of the system as it has been constructed. And so my optimism actually comes from the shift in that consumer expectation on two dimensions. The first dimension is like Jason just said, high quality care can be delivered across multiple modalities. That might be an SMS communication to fill a script. That might be a mental health visit via telemed. That might be an in-person visit for something else. But sort of the consumer mental model was open to what is possible in a way that we hadn't seen previously. And then my second, which slightly more provocative comment, is the other mental model shift that happened was, I think consumers, sort of the paradigm that you must look through your plastic insurance card and only looking through there tells me what is possible in my own healthcare. I think that has some signals of being broken as well, right? Because the trust that consumers have had with the insurance companies already quite low. And I think the pandemic exacerbated that in many ways. Now, the reason why I'm optimistic is certainly not the demise of the insurance companies, which are strong and innovative and doing great things, but is the consumer belief that something else is possible, which enables all kinds of innovation in the space, right? We see 5 million consumers per month coming to Solv, seeking to fill their everyday healthcare needs. The proportion of that are looking for cash pricing, as an example, as they've seen that reimbursement rate might be the cost might be higher through their insurance negotiated rate, versus cash, has increased. GoodRx, right, and their entrance into the public markets, I think is another example of I can get a discount on the drugs that I need. And it is another option outside of looking through that card. So on those two dimensions, my optimism comes from the consumer paradigm shift that I think, and I hope, frankly, we continue to see post-pandemic.
You mentioned something that I agree is provocative, and I want to touch on a little bit here, which is, what do people in this roundtable think about the idea that consumers do need to be retrained about what's possible a little bit? Because I've covered health insurance for a long time. I've also been a health insurance consumer a long time. The medical experience just in general remains one of the single worst consumer experiences I've ever had. Frankly, it's right up there with my cable company. But I think that as a consumer and I talk to other consumers, there's not really a sense that this can be better. I know there's been a lot of attempts to innovate, but I don't think people have necessarily gotten into their heads that, hey, this could be different. Small things of improvement or small areas of significant improvement, but what needs to happen for there to be kind of a a consumer revolution that drives demand to people who truly do things differently. And I know, I believe we've had a couple of folks, but I see, who is that ready to chime in here? Why don't you all go ahead? Go ahead, Nick.
Can you hear me now?
Yes, you're good. Fire away.
I broke the bingo card. I think the word retrained is really interesting. It's really hard to retrain people to do things. What is possible is to let them experience something new and decide for themselves. And I share Heather's optimism, because what we've seen is this new context of the pandemic that initially was forcing people to get care virtually. I appreciate Dr. Sheikh's comment, but I would argue that in the next 5 to 10 years, if virtual care doesn't become the front door to both traditional medicine as well as mental health, it's creating an additional cost burden on an already overburdened system. So I think the number one point of optimism is, yes, we have seen people select virtual care. I run a company called Decent that helps small businesses band together to get favorable rates and regulatory treatment like big companies do. We offer plans that are built around virtual care. 70% of people are choosing those virtual care plans. I thought it might be 20, 25%. And when we ask them why they're choosing these plans, and they're very happy, they have a net promoter score of 79, it's not about the pandemic. I really thought it would be, I don't want to go into the doctor's office and be around sick people. It turns out this is convenient. And I think that's the whole thing that this thing is going to turn on, is people have experienced something new. The other point of optimism that has come out of the pandemic to me is there's a recognition of the need for insurance. And I know that's a dirty word in some realms where people want to talk about cash pay, but the problem with the pure cash pay argument is we're all kind of hoping not to be the one that gets cancer. So I think insurance has a really important role to play. People are recognizing the value of that role. And it's kind of on the people on this call to figure out how can we translate what should be these cost savings to more affordable options for people, because the other big bear in the room is it's too expensive. And I think there are many, many different people that are taking shots at that. We're certainly one of them. I think most folks on this call are trying to work on that. But that's the other point of optimism, is people are recognizing there is a need for insurance. Now, how can we deliver what ought to be a more efficient care model and turn that into savings for the customer? Because if we don't, it's kind of come down to government to come up with something like a public option that has a tremendous amount of downstream effects. And so I'm hopeful that we can solve this with the private sector.
Matt and Kathy, I see your hands up, so I want to come to you all. Kathy, why don't we start with you, and then we'll go over to Matt, and then I'm actually going to come back to Jason and Dr. Sheikh with a question about some of the international consumers and the dynamic there. But we'll go to Kathy first, and then to Matt.
Yeah, so I think that everyone's pointing to some kind of out-of-the-box thinking and some, sort of new models that we've actually tried and proved really effective. But I think that if we could collect this on a global basis, it's really a shame that we've become incredibly, I would say decoupling in our attitudes, especially here in the U.S. And if you look at the China system, for example, and the internet hospitals that have grown and really flourished, particularly during the pandemic, it's extraordinary. So the access and the penetration into the 3rd and 4th tier cities in China has really improved dramatically as a result of these internet hospitals, access to expert care, making sure that people don't have to stream into the cities to specialist hospitals in order to really get, attention. That's relevant, highly relevant to the population that Vivek is talking about, the underserved populations, really everywhere, and the rural communities that really just, even today in the U.S., don't have access either don't have access to hospitals any longer in their communities. So I think that trying to gather key learnings coming out of this would really be extremely helpful, and really figuring out together in a collaborative way, again, as I said, keeping these unusual alliances that have actually emerged during the pandemic, to see how we could change the policies and enable some of the reforms and some of the innovations that have really popped up, whether it's in Qatar or whether it's in China or wherever it is, because there have been very dramatic outcomes from some of these new models.
Matt, can we go over to you real quickly?
Sure, absolutely. I just wanted to point out and maybe tie back to something Kathy had said earlier, which is there's an attitudinal challenge in our industry in general. It's incredibly, I focus on the benefit side of the world, and it's incredibly risk averse. Those making the buying decisions, those that are involved in pricing, there's an element of an attitudinal change that I think, and as Heather said, I think I'm pretty optimistic as well, is that there's been a few layers peeled off of the system so people can actually see what's transpiring. I know what we do, part of what Pickwell does is we predict risk for an individual as they're going through their benefit selection process. And that risk is really looking at what are all of the components and how do my choices impact that. So it almost becomes like risk planning software in some way, shape, or form. But until the ecosystem of buyers has an opportunity to see what really is possible, and now they have with telemedicine, they've seen it with, there's a just hyper specialization in our industry right now. Organizations that are providing virtual musculoskeletal support or providing ambulance services via the internet to fly them to more either cost-effective or higher quality services. It's just an immense amount of specialization. And I think that the market, I think we have to stop sort of as we think about the benefits buyer, it always tends to be a race to zero. How do we get the cheapest product possible? And that tends to degrade the service. I think with hyper-personalization, what you're going to see is a greater demand. Me as an individual and the individualization of my selection process, there's so many more options now for me as an individual employee. It doesn't just purely rely on my employer's health insurance. It's an important part, but it's not the only part. And I think those attitudes are really starting to change pretty significantly.
I want to come back to this attitudinal question, but kick it over maybe to either Jason or Dr. Sheikh or anybody else who has either worked in or has an employee base in markets outside of the U.S. I mean, I spent, right before the pandemic, actually, I spent 3 or 4 weeks in China talking to people in their healthcare system, foreign employers there who are, buying into the private hospital networks. So very, very different buying and acquisition of health insurance and health benefits in these markets. For those of you who work in these places, I mean, how does either the patient/consumer or the employer-consumer attitude compare to the United States? And how do you think that it may have shifted during the pandemic or may come out of the pandemic different? I'll kick it open. I mentioned Jason and Dr. Sheikh, but please, anybody who feels ready to answer this, feel free to jump in.
So let me take a first crack at it, Drew. First of all, tip of the hat to Heather. You spread your enthusiasm and optimism so much that 3-4 people said they agree with you, and so do I. So I think we can look at it with rose-colored glasses, and that's what I will do in my comments, and I'll come back to it. I think in terms of the differences in attitudes as a consumer, I spent most of my adult life in the US, so I'm very familiar with the experience of healthcare as a consumer as well as a provider. And Drew, you were talking about one of the worst experiences going to provider, and I agree with you in the US. I still compare, by the way, very different in Qatar though. And for a variety of reasons, but I'll just point out 2 or 3. One, here, we are fortunate because the country is small and it has resources, and the government is, as I said, the largest funder as well as provider. However, that has also given rise to competition between the healthcare institutions to get involved in preventative care. I can give you an example of what we are doing. There was a comment, I think maybe Nick said that it's very hard to retrain people and change behavior, and I agree. However, if you start early, and we have about 8 years ago, we went to elementary schools and got the kids involved in starting a program, Your Health First, and got them to eat vegetables and fruits and grow, and ultimately actually get involved in bringing them to the market by the time they get to the high school. There has been a tremendous change in their behavior. Now, yes, we can't compete fully with the McDonald's of the world, but we are getting there. What I'm saying is that you have to start thinking about healthy behavior at a much earlier time in your life. Now, getting to the cross-section in terms of the difference in experiences of consumer between the US system and elsewhere, I can only compare with Qatar, as I said earlier. US system has major problems because it is a contradiction of conflicts. You have multiple stakeholders competing at the same time jiving with each other. I mean, I come from an academic background, but I run a health care system in California when I was over there, one of the two hospitals associated with Stanford. So you have people coming in from one point of view, you have insurance carriers from another point of view, then you have people, clinicians coming from another point of view, researchers from another point of view, and there does not seem to be any cohesion. And a poor consumer or patient is the one who is the sufferer. And that's why when I was making earlier comment about more of participatory care, unless we get the consumer involved intimately in their own care. And there are apps out there now which help them assess whether it's a sleep or heart rate or blood pressure or whatever have you. Get them involved, even if it's involvement with the gizmos initially, but that will make a tremendous difference in terms of their participation.
If I can just sort of supplement some of that, I mean, I've lived and worked internationally for 30 plus years. Cigna has operations across 30 plus countries outside the US. Probably one of the biggest differences I see between the US and non sort of US sort of markets is the role the employer has played historically. You know, in the US, the employer has been the key, you know, aggregator, had a sort of central role to play. That's not the case in many markets outside the US. And yet, you know, if we all, you know, recognize that prevention is better than cure, and we want to focus on moving towards well care as opposed to sick care, this ability to get the individual to take responsibility for his health, for his wellness, eating healthily, exercising, and all those other things, it's more difficult when you've got to do it effectively on a one-by-one, whereas where the employer is both incentivizing and penalizing sort of, you know, their employees for not having the sort of right behaviors. And I think that's one of the biggest challenges outside of the US is sort of moving to that where you haven't got the employer always playing such a big role. But again, as a result of the pandemic, where again, sort of public health systems outside the US played a much bigger role, you know, in dealing with COVID cases, in vaccination rollouts, etc. That they've come under immense pressure. I mean, you look at the challenges faced with the NHS in the UK, for example, and now the backlog in terms of, you know, cancer treatments and all the rest of it. This is going to create, you know, perhaps, you know, prompt people to realize they do need to take some action and some responsibility themselves.
Vivek, Ali, I wanted to turn to you all. I mean, have you all seen the purchasing behavior, you know, as we think about, you know, what this selling season is going to be like and the previous sign-up season, kind of mid-pandemic? I mean, have you all seen the behavior by your customers shift from what you expected in terms of the type of coverage that they're buying or the type of coverage that they're seeking, or ways that they may be supplementing what they are buying?
So I think for us, at least in our space, so the Medicare population, which is essentially over 65, I think a lot of that's to be determined. So the main selling season is generally the latter part of the year, so October through end of the year. So for obvious reasons, a lot of that hasn't shifted too much, given it was minimal, given lack of kind of in-person ability, which is generally how a lot of sales are done. So I think what's going to happen over the next many years is I think kind of what you're referencing which is the nature of what folks are buying. So just kind of going back to the question you had earlier in terms of, you know, retraining consumers and what are consumers going to be expecting. I think what has happened, if we think about this shift to virtual care, the best comparable, I mean, the crudest comparable is essentially when, you know, cellular phones came out. And so we take like the Motorola flip phone, there was a stage of phones where it was just a race to get the phones as tiny as possible. And I think we remember that if we go back 15, 20 years ago. But all that was just a different mode of communication that I know Ali and others have referenced, which is it's, you know, we view it as another mode of interaction. And then you fast forward 7, 8, 9 years later, and then you have the advent of the iPhone and Android phone, where essentially the phone became an actual platform for a different way for you as a consumer to engage with technology. information, knowledge. And so I think right now the general marketplace is viewing virtual care as just another way to communicate, which is true. But that I think is very comparable to the flip phone. And so if we kind of fast forward 3, 4, 5, 6 years, the real sort of power that's going to be unleashed are those insurers, those organizations that can actually enable physicians to drive much more meaningful interactions with their patients. So if you're engaging with your patient virtually, what information is brought to bear to make that interaction super valuable, super impactful? Right now, I think you have kind of two types of approaches. You sort of have the Amazon or the Walmart approach, which is very much around how do we just get more doctors in the system to engage with you virtually. That's somewhat of a short-sighted approach because it's just adding more physicians to the ecosystem on a virtual basis. That's not actually enabling more meaningful interaction. So I think the winners are really going to be the ones that recognize how do we take the existing physician base and allow them to be much more successful on engaging with their patient population. That's where intelligent software, intelligent technology comes to bear. And I think in 10 years from now, we'll sort of be able to make a comparable of the flip phone versus the iPhone concept. And those focusing on the latter are probably going to drive not just a lot of business value, but true consumer value.
Yeah. Ali, what about you? I mean, what have you seen in terms of the behavior of your customers and what they're seeking and how they're seeking it?
I mean, I would say statistics are helpful here. So in the US, at least, to Jason's point, employers cover 50% of Americans. They provide coverage to 120, 125 million people. And then if you look at the US healthcare system, we use about the same amount of care per capita, whether it's surgeries, drugs, visits, as our OECD counterparts, Europe, Japan, Korea, et cetera. The only difference is that the unit cost, what things cost in the US, is 150% more. And I say that, unfortunately, the health insurance industry in the US is complicit in allowing that to happen. They have choked supply to services and drugs now. Now they all own the big pharmacy benefit managers, or drug distributors is really what they should be called. And there's a perverse incentive to want to hide from view what their underlying costs are and what their markups are on those good services. And so employers, and I think Vivek is absolutely right, I think employers are clamoring, and their people, of course, for a more direct relationship, not only sort of a service standpoint, but also a commercial standpoint with the people providing their care, and thereby a much more transparent understanding of what they're getting for their money. And so from our perspective, employers on our platform, we provide a self-insurance platform for large employers, have been doing this since we started 8 years ago. And I'd say the pandemic has only fueled that acceleration because that chokehold that the big 5 or 6 insurers in the US have on the supply of healthcare services and drugs is being challenged by emerging new platforms like Solv, or platforms that are providing direct primary care direct to the enterprise, direct to the individual. And so there is now an opportunity. I actually use Vivek's analogy all the time internally. There's a Wi-Fi option now where I actually don't need to buy that cellular PPO network. I can just go direct to One Medical Group, or I can go direct to Lyra, or I can go direct to Progyny, or I can go even direct to a big hospital system if I'm a big employer, and contract with them without the need for an insurance network and all of that sort of opaque knitting that underpins that network, particularly around what the actual price of service is. And I think we will see just more and more and more of that as the days sort of come, and the funding of all of these new emerging, principally virtual, but I'd also say now increasingly physical healthcare options that are direct to consumer or direct to enterprise is just an indication of where the market's headed. And our platform is designed to support that proliferation. That's what we've built it for.
I want to ask a specific kind of COVID question here. How are you all thinking about kind of the long-term cost of some of these folks? I mean, we've had a lot of people hear about long COVID. I'm sure all of you know someone who's been ill enough to need, not just hospital care, but long-term rehabilitative care afterwards. Those of you who are in the benefits and insurance space, I mean, what is your thinking about what the costs of this pandemic are going to be after the pandemic, but when we have lots of people who may have residual lung damage, may need types of physical therapy. I mean, how are you all thinking about how significant those costs will be and how they're going to factor into your businesses going ahead, potentially over the next years?
I mean, certainly from a Cigna perspective, and again, it's difficult to answer this one at the moment. But I guess I'm more concerned about the non-COVID related implications, the people that didn't get access to treatment when they needed it as a result of the pandemic, and the sort of implications of that. Again, the way sort of mental health has been, further accelerated as a result of the pandemic, and people having to sort of juggle work, children, elderly parents, all in the same environment, etc. I think it's the impact on those areas which is going to be much more significant than necessarily the people that have long COVID and some of the implications of that. Not to say that for those that have that it's not going to have a dramatic impact, but I'd say it's much more the other aspects of illness, wellness, etc. that are going to have more fundamental implications.
I think it's a huge concern. I mean, the data is still really recent, but there's definitely recent studies that have shown that we have up to 20 to 25% of individuals who've been diagnosed with COVID. A month later, they're going back with new conditions. So when you think about just kind of the sheer, now that doesn't necessarily mean those are severe chronic conditions and they're going to be admitted into the hospital, but we don't really yet truly understand the longer term clinical implications of COVID. And these aren't just individuals who were acutely ill with COVID, but these are those mild to moderate symptoms as well. And in that group are those who are asymptomatic but were diagnosed positive. So I think when we fast forward, the implications are large, the cost implications are large, and a lot of these individuals are younger as well. So it's not just exclusively those who are elderly. So I think when we think about a lot of the unbelievable progress, particularly in the mRNA vaccine, I think there's significant dollars in research that needs to go into what are going to be the more permanent treatments for those who are experiencing conditions after.
One of the things that I'd add to that, I think, as we think about what Dr. Sheikh had mentioned earlier about the mental health side of this, I think there's a bit of a wave or a pig in the python coming through, and we see it in spades here in the U.S. In our major cities right now. There's an immense amount of angst and anxiety that's playing out in the form of gun violence. I think that gets a lot of, obviously, media coverage because of sort of the significant nature of it. But there are a lot of folks that have been isolated for quite some time. And part of that isolation, if they don't have availability to some sort of virtual care, that's impacting this as well. Or there's a fear of engaging in the broader system again, or has been over the past year and a half. And so I think the challenge is that I think we're going to start to see a wave, and I don't think it'll be a singular wave. I think it may start. I think what's starting right now, at least here in the U.S. and major cities, is it's a wave of gun violence. Right? People are getting out. They're angry. There's a lot of anxiety. It's facilitated by just sort of this rampant some challenges on social media. Hitting our younger populations. I do think we're going to continue to see this wave play out, or multiple waves play out that are going to be impacting, as an employer myself, looking at the health of my employees. Did they receive care? Did they not? Where are they from a mental health standpoint? How are all these things playing out? I don't think we know yet. I think I certainly don't want to close on a pessimistic note, but I think we need to address it and leverage the resources that are available to us as employers.
Well, I know we only do have about a minute left here, but I want to ask, I think you bring up an important and provocative point, Matt, that we see about some of these kind of symptoms of the most extreme effects of mental health. But do you think there has been that connection made in the public or policy mind that, hey, we really do have a significant, people say, oh, we have a gun violence program. We have people attacking people on airplanes problem. Do you think that connection has been made back to the fact that there is a vast undercurrent of mental health issues that are going to have to be dealt with from a kind of medical coverage sense?
I don't believe so yet. I really don't. I think people are just starting to have the conversation. I think I think either Drew or Dr. Sheikh, one of you had been on the airplane and or Dr. Sheikh, people were going back and forth with each other and being frustrated. It's everywhere. And I think it will start to slow down a little bit from that perspective, but there's other mental health conditions behind that. I don't think we're there yet.
Thank you. We have to cut it off here. Thank you all so much. I really appreciate your time. This has been a wonderful discussion. Thank you.
Thank you.
Thank you.
Thank you.